Hello everyone and welcome back to my channel. If you're just stumbling on my video for the very first time, my name is Dorothy Shetang and I am a pharmacist living and practicing in Nigeria. If you are just coming or stumbling on this video for the very first time, you're very much welcome to the family. Please make yourself comfortable, and if you are a returning subscriber, thank you for always coming back. Today's episode of Pharma Talk, I'm going to be showing us how to perform a pregnancy test using a pregnancy test strip. So I get this question a lot from a lot of patients when they come to the pharmacy to procure pregnancy test strip, and a lot of them are like, I don't even know how to use it. And I go on and on and on trying to explain this on how to use the pregnancy test strip at home. However, it's important that I also share it out here with you, my subscribers, my viewers, on how to do this at home so that you don't end up having a wrong result. So in order to perform the pregnancy test, it is important that you get yourself three important things. Number one is your test strip, very important. Number two, which you are the source, is your urine. And number three is a little container, like a mini bowl, something like this, to collect your urine. For the purpose of this video, I'm not using a urine, I'm just using water here just to demonstrate, to tell you how to use it. This is just for demonstrative purpose, not for real, actual, practical. So it is important for you to get your test strip, your urine, and a little bowl, something like this, to collect your urine. There are some products that do have a mini bowl like this inside the pack. Product like Predict, yeah, I think they do have a mini bowl for collecting the urine in it, but for these ones they just have the strip. So you have to source to get something like this, a mini bowl, something you can just collect your urine in it, and then you have your strip. In order for you to get an accurate result, especially if you're trying to check immediately after you have missed a period, it is important for you to collect your early morning urine. I know a lot of persons are always asking the question, why does it have to be the early morning urine? So basically, what the test strip picks is the amount of HCG in your urine. However, it is important for you to know that HCG is more concentrated in the urine during the early hours of the morning, especially during the time when you pass out your first urine. It would have piled up all through the night, and then it is concentrated there in the morning. So the early morning urine usually have a higher concentration of HCG. Let's delve into the video. In this container, I have my urine, and this is the test strip. So I'm going to be opening it up. So you'll see something here inside the pack. This is not what you need. This is called silica gel. This is called silica gel. It helps to prevent moisture from affecting the test strip. That is why it is there. So it is serving like a preservative. This is not your active ingredient, or this is not the active strip that you need. This is not a strip, this is a preservative to preserve the strip. This is the main strip, and we'll be zooming in a bit. So yeah, we can see a line here. You can see a line here. Yes, this line is where you would stop when you're dipping the strip into the container containing the urine. So this is like your stop line. So we're now going to dip it into the urine. So you watch this. This is the container, and this is it. So you see me dipping it. I'm dipping. I'm dipping. I do not want to cross the line, so you can see, you watch closely. Yes, we are there, right there on the line. So that is where you are going to stop. You shouldn't exceed that line. Immediately you dip it, you see a movement. Are you seeing a movement somewhere up here? This line wasn't there before, it was clear. So you can see there's a movement there. Yes. And you're seeing a dark line up here, right where my finger is. Good. Now when you dip it, it has gotten, you allow it to flow. You place on a flat surface. So you place it on a flat surface like this, and then you would read your result after 2 to 3 minutes. So we're going to be waiting. So 3 minutes is off, and then it is time for us to read the results. Look closely. Look closely. Look closely. This was the line where we put the mark. There was nothing here at this point. But right now you can see a red line here. Can you see it? Perfect. This red line is just one of it. This tells you that the result is negative. This tells you that the result is negative, which means you are not pregnant. Why? It is just one line. If you have another, in addition to this line, if you have another line somewhere around here now, it tells you that you are pregnant. So if you see 2 lines, it means that you are pregnant. If you see 1 line, it means that you are not pregnant. 2 lines, pregnant. 1 line, not pregnant. And if you do not see any line at all, if after you have dipped it into the urine this way, and at the end you did not see anything, even this red line you're seeing here is not there, it tells you that you have done the test in a wrong way. It tells you have done the test in a wrong way. The test was not properly done. The test was not properly done. So it is important for you to go back and do it again. So if you dip the strip and you don't see any line at all in this region, in this area, you don't see any line at all, you can see the red line is very visible. Just one. But if you don't see any at all, it tells you that it was an incorrect test. It is not valid. It means you didn't do the test properly. Was this tip helpful? Follow for more. Bye.